So, what was the moment when you realized that medical was your calling?
My mom had to undergo a surgery. She had some complication at that time after her surgery, and we visited few hospitals for her treatment. It was the moment I started thinking that I should take medical and I should become a doctor and serve the humanity.
How has technology changed the way you function?
Now our hospital is paperless. Everything is online. We have a lot of technologies in the OTs like Da Vinci robot, orthopedic robot, ophthalmology robot, all kind of latest technology we are using at Sohana Hospital.
Have you seen more joint or spine issues in younger people?
Yes, definitely. Nowadays, a lot of students, a lot of IT professionals, if you sit on the computer for most of the time, you start having your cervical pain or neck pain, we call it.
Difference between a normal joint replacement and a revision surgery.
When he or she doesn't have undergone any kind of surgery before that, and he comes to us with a knee problem, and then we operate on that knee and we call it as a knee surgery or a knee replacement surgery. But this knee replacement surgery has a life, maybe 20 years, maybe 25 years down the line. He might undergo another surgery which is called a revision surgery. That's called a revision knee replacement surgery.
It's an honor to meet you today. We would really like to know about your experience in orthopedics and robotic joint surgery, as well as being the CEO of Sohana Hospital. We're quite excited to know about your journey and experience, as I'm sure many of us aspire to be doctors one day. So let's begin.
First of all, I welcome you all.
Thank you, sir. Thank you, sir.
From Vivek High School. This is first time I'm being interviewed or being questioned by the students, so I'm excited too. So, well, if you ask me about the journey of myself in this hospital or as a career of mine as a doctor, it's been like almost 30 years now. I joined my MBBS in 1996. Then I did my graduation, post-graduation, worked at various places, and eventually I joined this organization in 2011. And it's been like 14-15 years I'm here in this organization as a CEO as well as a Chief Robotic Surgeon here. So I'm glad to share my journey here. You ask me whatever you want to ask.
Thank you so much, sir. So, what was the moment when you realized that medical was your calling?
It was like, when I was in 10th standard and my elder brother was doing engineering, and more or less my parents and everybody was thinking that he's quite intelligent, he'll also become an engineer. But my mom had to undergo a surgery in the month of November in 1995. And she had some complication at that time after her surgery, and we had to take her to some other hospital. So that 3 months of duration, we, ran from one door to another door. We visited few hospitals for her treatment. And in those 3 months, I saw, the irony that how the patients were being treated by the doctors and how the doctors used to spend the whole day, because I used to be in the hospital for whole day and night with my mom. At that time, I thought that I should be a doctor. That was the moment I started thinking that I should take medical and I should become a doctor and serve the humanity.
That's such a challenging moment, and thank you for sharing it with us, because I know it's
It was very emotional and very tough time for me at that time, but it changed my entire life, I guess.
It must have been a very impactful moment.
Yes, it was.
You're a surgeon and the CEO of a leading hospital. So how do you balance both responsibilities, being in the OT and in the boardroom?
I did my orthopedics in 2003, and after 2003, it's almost 22 years, I'm a surgeon. So my first passion was surgery, and I became a robotic surgeon like 15 years back. I started learning robotics. So when in this hospital in 2013, they gave me an offer to become a CEO. So it was a very tough time for me. It was a challenging decision for me to become either a CEO or continue as an orthopedic surgeon. But, it was grateful to the management of the organization. They gave me the role of both the things, being a CEO also, as well as continue my passion as an orthopedic surgeon. So as an orthopedic surgeon as well as CEO, sometimes, while operating or after the surgery, you're in the theater, but you have to do as a duty of a CEO also. So multitasking is very important for me. So I was good at multitasking. That is why, it gave me, the kick, or it clicked my career, both sides, as a CEO also, as well as a surgeon also. So when you are in the OT, you have to take different decisions. You have to take decisions pertaining to the surgery, pertaining to the life of the patient. It's all your education which comes into the picture when you are, or your experience when you're operating. But when you are in a boardroom, when you are in meetings with the management or with the senior officials of the hospital, you have to take different decisions regarding the hospital, regarding the upliftment of the hospital, bringing new technologies, bringing new departments, what better you can do for the organization. And I think I'm doing both of them. You can see how the hospital is growing and what kind of infrastructure or what kind of technology we have. This all because of my hard work and my blessings of the God as well as the management support.
I'm so glad that you were able to pursue both passions. So, with your vast experience and knowledge in this field, how has technology changed the way you function? Because you mentioned before that it was only 15 years back that you started this journey in robotics.
See, technology, as you all know, our generation has seen everything, right from without phone, then the land phone, then the cordless phone, then the mobile phone, now the smartphones. I don't know what AI is going to bring.
Yes.
So we guys have seen no technology to the best technology here. I don't think you guys can think to live without phone, but we have lived our life. In our college time there was no phone. So I think we have learned the technology and how to use it from last 20-30 years. It was a great journey to learn technology first, then to bring it to the organization, bring that technology to the hospital, and then use it. Because bringing technology is okay, but you have to use the technology for the betterment of the patients, for their treatment, for organization. But technology has really helped us in the medical science. Now our hospital is paperless. We don't use paper. Everything is online. We have digitalized the entire organization. Once the patient enters the hospital, registration is done on the computer. Then the doctor sees the appointment. He writes the prescription on the computer. The tests are done. It is sent on the phone, on the app. We have a Sohana Hospital app. You register on your app, you come to the hospital, you go back home without a prescription. Everything is on the app. So with the technology, we have done so many improvements in the organization that your back data, your past data, you have visited the hospital maybe 3 years back, but once you come back, you don't bring your card. We can see your background. We can see the treatment which we gave you 3 years back. Any doctor can see any report at any given point of time on the phone. If he or she is at home, the patient is serious in the hospital, something goes wrong, he can just open your phone and he can see the reports, see the x-rays, CT scans, MRIs, everything is integrated in the computer with the help of technology. So this is only for the benefit of the patient and for their treatment. And if we talk about the technology in the indoor patients, we call it IPD patients, which are admitted in the organization. For them, we have a lot of technologies in the OTs, like as all you know that we have robotics here. So there are three different types of robots which are used in the medical science. One is called Da Vinci robot, which is used for all kind of abdominal surgeries. All abdominal surgeries, be it a gynae surgery, be it a general surgery, be it a urology, any kind of a surgery which is there for the abdomen is being done by the robot. Then we have orthopedic robot, which I am using for knee replacement and hip replacement. Then you have ophthalmology robot, all kind of latest technology which is available in the Western world, we are using at Sohana Hospital. And with the help of this technology, we are giving the best results. So I think technology has been the boon to the medical science.
Yes, that's what I was also thinking. Because nowadays we can see people being addicted to phones and other technologies. So it is very happy to know that technology has helped such a good field, something that helps people.
Yes, definitely. Technology helps, whereas technology is a double-edged sword. As you said, it is harmful for some people, it is good for some. I think we should use technology for good purposes
For better.
rather than using the technology or mobile phone for entertainment, for other sources, or using it for a different manner.
What is the biggest mistake you think that people tend to make when it comes to taking care of their bones and joints? Like, for example, taking the wrong medicines or such.
The biggest mistake people do is when they start having some kind of joint pains, at I would say at the age of approximately 40, 45, which is the middle age, or the middle age is going into around 50s, you start feeling some kind of discomfort in your joints, or you start feeling some kind of pain when you're going upstairs, downstairs, walking up the hill, down the hill. So that is the one point that your knee or your any other joint has started giving you a hint that something is wrong. At that point, most of the people do the mistake, they start doing exercises. They don't consult a doctor, they start gym, they start walking, they start doing running, they start to any kind of exercise they feel like, or somebody in the neighborhood or somebody in the friend circle, they start telling, they start going to the quacks, they start take desi medications or over the counter medicines without consulting a doctor. I think this is the biggest mistake, because that is the time when you can keep your joint healthy for a longer time. That is called the very early stage of any joint disease. So at that time, if you don't consult a doctor, don't take a proper treatment, the time is gone. That, for a few months or few years, when you keep treating yourself on your own, or you start doing some kind of wrong exercises, even injuring your joint more, it, worsen the disease rather than improving it. And when they come to the doctor, already that time has gone when they should have come, and they could have taken care of the joint and would have taken the back health of the joint as a normal joint. Then the time comes and you have to treat it either medically or surgically, something you have to do it. So I would recommend, if anybody is listening, that whenever you have any kind of symptom in your joint, the lightest of the lightest symptom would be any kind of discomfort when you get up in the morning, or any kind of discomfort when you climb upstairs, when you climb downstairs, or when you're going for a trip or you're for any vacation, you feel that your joint was, you were not able to move, or you were a little bit in discomfort in that whole trip, entire trip. It won't be like that you need a painkiller, you need a medicine for that, but kind of some kind of feeling in you that you had something not okay. But at that time, you should consult the doctor.
I think it's safe to say many of us have seen this in our parents and grandparents. Both my grandmothers actually had to have knee replacements as well, because they use these over-the-counter medications from recommended by their peers or other family friends. So thank you for the information. I'm sure it will benefit a lot of people.
Hopefully.
Yes.
Good evening, sir. I'm Abhyacher and I would like to ask you a few questions. With more exposure to mobile phones and less focus on outdoor games these days, have we seen more joint or spine issues in younger people?
Yes, definitely. Nowadays, we see a lot of young people coming to my OPD, lot of students, lot of IT professionals, lot of teachers, of course, they're coming to us, because of the technology driven problems. Like we would say that IT problems, because if you sit on the computer for most of the time, you will have to keep always looking at the PC or at the screen. You will start having your cervical pain or a neck pain, we call it. So neck pain is the most common problem which we see because of the technology. Secondly, if you use phone for a lot of time, then also you have to bend your neck and see the phone. Then also you have a lot of time, you have vertigo problem or you have a neck pain problem. So I think technology has these issues of giving orthopedic problems.
This is very informative and good to know what's going around. Our listeners are intrigued to know about the difference between a normal joint replacement and a revision surgery, and why revision surgery considered more complex.
A normal joint replacement, we call it when a patient comes to us when he or she doesn't have undergone any kind of surgery before that, and he comes to us with a knee problem, and then we operate on that knee, and we call it as a primary knee replacement. Primary means it's the first time we are doing a knee replacement, and we to resurface it or replace it, and then we put the caps on the joint, and the patient is fine. That is called a knee surgery or a knee replacement surgery. But that this knee replacement surgery has a life, maybe 20 years, maybe 25 years down the line, she might or he might undergo another surgery, which is called a revision surgery. That's called a revision knee replacement surgery. We take out the implant, which is already there in the knee, and we put another implant. So that is why it is a complex surgery, because you have to do two surgeries. First surgery, you have to take out the implant, and then you have to clean it up, and then you put another implant. So that is why it is a complex surgery.
I'm sure our listeners will definitely benefit from this information. We know that you have gotten a lot of international exposure, so we'd like to know how has that international exposure shaped your work in India?
In India, if we talk about a decade back, maybe 2 decades back, the medical science or the health facilities were not that up to mark, which is nowadays. As you can see, very good hospitals, good, clean, big hospitals, corporate hospitals, which were not there maybe 20 years back or 15 years back. When I visited abroad, I stayed in the US, I stayed in Australia for few years or few months in different countries, different hospitals. I saw the kind of technology they have, the way they treat the patients, the latest gadgets they use, the system or the protocols they have made to treat the patient, and the kind of results they were giving, which we used to lack here. So, with the help of my exposure, I brought those technology in India. I brought those ideas to India, and we tried to build our hospital at par with the Western world. And I would say, with my exposure and with my experience in the different countries, our hospital is now at par with the Western world. We have all kind of technology, all kind of treatment which any other Western country has. As of now, today, at this date, we do have the same treatment in our hospital with the same kind of machinery, with the same kind of technology, and with same kind of medicines, implants. I would say everything which we are doing in our hospital in Chandigarh is as good as anything maybe done in UK, maybe done in US, or maybe in Australia. So this is what I got benefited from my worldwide exposure.
We are actually really glad that you're giving back to the nation. You truly are an asset to the society.
Thank you very much.
Sir, I wanted to ask you, you must have had so many special moments throughout your journey. Would you like to share any one moment that actually felt proud and emotional?
During my career, there was one day, which I was very emotional. On this day, I actually operated on my father. So my father had a knee problem like 8, 10 years back, but due to certain reasons, he could not get his surgery done because of COVID. After COVID, a couple of years back, he was not able to walk. Actually, I couldn't see his pain. So, we decided to go upon for his surgery, and my father wanted that I should operate on him. But that time when I operated on him, when he was out of the OT, usually when I come out of the operation theater, I meet the patient and meet the attendants as a doctor. So on that day when I operated, I was the doctor and I was the attendant. I signed the file, or I signed all the consents for the surgery myself, and I operated, and I signed all the documents myself as a doctor also and as a attendant also. So that was my most emotional day of my life, operating on your father.
It must be very challenging for you.
It was really very challenging for me, and it was very emotional for me rather.
I'm glad to know about.
Good evening, sir. I, Sirat, would be taking forward this interview. So, my first question to you is, what daily habits would you recommend for children like us to keep our bones strong and healthy?
See, due to your curriculum nowadays, the children are really busy. They have a lot of schools, they have a lot of classes, they have to do extracurricular things like you are interviewing me now. So as you guys have paucity of time, this is what I think. At least 30 minutes of your every day from out of your 24 hours, you should give to yourself, your body, in any kind of exercise, any form. So this is the main advice I would give you. You either do some kind of sports activity, or you join some kind of, I would say, high intensity exercise, some kind of dance exercise, dancing, any passion you want to do, which gives you some kind of half an hour to 45 minutes, give to your body in form of any kind of exercise, I would say. This is the most important thing. Second, nowadays children are away from the home food. Children are away from fruits. They don't like fruits. They don't like home food. They don't like, diet food or healthy food. They want to have is junk. They all want to have the outside food, chips, cold drinks. I think this you should refrain from as much as you can from these kinds of foods, and try to have at least 6 days a week home food, and once a cheat day you can have. Please do, if you want to keep your bones and joints healthy, please take care of your diet, take good nutrition, and spend at least 30 minutes every day on exercise. Once weight gain is there, you become obese. It is very difficult to reduce your weight. So obesity is one thing which should be always taken care of. You should not feel like you are overweight, or you feel like your friends are saying this, that you are overweight, or you are not able to do exercise because of your weight. This is the time you should start exercising and go for a good diet.
It's a really good piece of advice. I'm sure we all will follow it.
You will?
Yes.
You promise?
Yes, sir, definitely.
All of you, boys,
Do you think dancers and athletes need to take different care for their joints? And what advice would you like to give them?
See, not only dancers or athletes, I think anybody who is doing high intensity sports or any kind of an activity in which you need to have a high intensity workout, you should take care of joints very specially, because you are prone for a lot of injuries. Whenever you go in for any kind of high intensity activity, like you go for a dancing session or you're going for any match, so you have always seen that before the match, all the players of the opposite team, they do pre-workout or they do stretching of their muscles, and this is the most important thing. This is the piece of advice for them, that they should take care of the joints before going to any kind of high intensity exercise. They should do workout, pre-workout, and they should do some stretching of the joints, and so that they should avoid any kind of injury. So they have to take care of the joints really well, and after the game or after the session of the dance and anything is done, then they also do for relaxation exercises. They should go for stretching, massages, so that their muscles, their joints, their blood circulation should be maintained, and there should not be any kind of an injury to them. So the stretchability of the joints, which is helped by stretching, should be done before going for any kind of exercise.
How is technology like 3D planning or robotics making surgeries more safer and more accurate for patients?
See, it's a very vast topic. You have asked me a question. So I can just put it in simple words. That's, as we have already discussed, a lot of technology. So if we discuss technology in the operation theater, robotics is the latest which has come up in the medical science in India. So when we use robotics in our field, I would be speaking about my field only. So that is, I am doing robotic knee replacement surgery. So when we do any kind of a knee replacement surgery with the help of robotics, the results, they are absolutely fantastic, because orthopedics is more or less a technical branch in which we use lot of instrumentation to repair the knees. So we have to nibble the bones, we have to cut the bones, we have to clean the bones and put the implants, and which is being mostly done by the manual instruments or the conventional instruments which we use with the help of our hands. So once the robotics came, what is robotics? With the help of robotics, before surgery, we take CT scans of the patient's affected joint, like knee or hip joint, which we are going to operate. We take the CT scan of the joint and we put that CT scan in the robotic machine. So with the help of the softwares, that robotic machine, they calculate the kind of damage that joint is already having and what is the remedy that is going to be done by the doctor or by the robotic machine. And before we go in for the surgery, on our computer, we can see that the virtual surgery is already done by the robotic machine. So once the virtual surgery is done, we can see the final result of the surgery before we have even opened the knee or before we have attempted the surgery. So one day prior to the surgery, we do a virtual surgery on that patient, on that knee actually, and we see that how much we have done the bone nibbling or the bone cutting, and how much is the size of the implant, what is the thickness of the implant, and what is the implant type, what is the implant size, what is the position of the implant, how much the bone you need to cut. All these aspects which we used to think during the surgery, it is on the piece of paper or on the computer, we have already come to know. So when you open the joint or when you go for the surgery, you are already ready with everything. You already know that how much you're going to cut, where you want to cut. So firstly, you don't have to apply much of the brains, which we have already done beforehand. Secondly, you have to only cut or nibble the area which is affected and area already defined by the robotic machine. Thirdly, that robotic machine comes into the play and helps us in cutting and milling the bone, because there are tools and instruments in the robotic machine which are very small, very thin, and they only mill or bone or cut the bone only the affected area without damaging the tissues. And if you do it with a conventional technique, you are tend to damage little bit of the tissues which is surrounding the bone. So we talk about precision. Precision is definitely better with robotics because you have used the technology. Accuracy, yes, definitely there won't be any kind of error because you are using technology. Thirdly, it is beneficial for the patients because you don't have any blood loss, because you don't injure any kind of tissues. So it is a less blood loss. So if there is a less blood loss, there would be less pain, there would be faster recovery. So patient will be able to move after the surgery very next day, maybe 4 to 6 hours after the surgery. We make the patient stand and walk, which these things are possible only because of the technology, which was not possible earlier 5-10 years before. But nowadays this is possible only due to the technology and with the help of robotic surgery.
What's the most difficult surgery that you've performed and how did you prepare for it?
See, we have done a lot of difficult surgeries. I don't remember actually any single difficult surgery or something which would have been my nightmare or something. I think we have performed a lot of difficult surgeries in our hospital. Mostly the revision surgeries which we discussed before, like revision knee replacement or revision hip replacement, are the difficult ones. Yes, when we initially started performing the revision surgery, they were very difficult for us to start with. We had to sit night back and you have to design the implant. We have to see what kind of implants are to be there. Then we have to order those implants. Because those days the implants were customized. We have to customize implant for every patient. We have to wait for the implant to come. And once the implant design and implant, everything is all right, then we used to perform the surgery. And during that time, we didn't have more options. We have to go for the implant, which we already prepared it by seeing the x-rays and everything. But nowadays, a lot of options are there as because of technology, and a lot of implant companies have come in India. So you have a lot of revision options. So during the surgery, you can change the option. That's not a problem nowadays. But yes, definitely revision knee surgery are difficult than the primary surgeries.
I am Arnab Prashar from grade 8 and I'll be continuing with this interview. What are some signs that people shouldn't ignore when it comes to joint pain or mobility issues?
See, the most common complaint our patients do have is joint pains. Usually they start with the joint pains because of certain reasons. There could be some blood investigations in which they have a problem. Usually you must have heard about high uric acid levels, that are causing the joint pains. Then when you get little elderly, you have normal joint pains. Then you must have heard about the word which normally is called gathia or rheumatoid arthritis. That is another cause for joint pains. So these are the basically disease which cause joint pain. So the joint pain is the most common symptom which should not be ignored by anybody who's suffering from any kind of joint pain, be it a finger joint pain, be it a knee joint pain, any joint pain which you start feeling or start having at any given age, maybe a childhood, maybe a adult, maybe elderly, then you should not ignore it. You should go to the doctor and ask for the reason, look for the reason that why you are having a joint pain. This could be a normal process of the life, that you are growing old, you have started having joint pains. That is called degenerative joint disorder. Whenever your joints start getting degenerations, so they start giving you pains. That is called degenerative joint disorder. That is a different aspect. That's a normal process of life. But you have in the childhood or maybe in your adulthood, if you have a joint pain, then you should go and ask the doctor that what is the reason for that, and you should not ignore it.
Similarly, sir, many of us live with our grandparents. So, what simple tips can we share with them to take better care of our joints and manage pain?
For elderly, I always give only one tip, that always keep yourself mobile. Only one thing which gives your joints a better health or which prevents your joints from aching or prevents your joints from getting stiff is being mobile. Most of the elderly you must have seen in your house, your grandparents, your grandparents, if that in winters they stick to the couch only. They don't move out, they don't go out. They always start saying you dadi nani or maybe nana nani. They know your joints are hurting. They want to go out. They're feeling stiff. They want to sit back in the quilt. But at that time, I think you should tell your grandparents, walk few steps. You should move. You should move in the house. If they can't go out, they should move in the house. If they can manage 10-15 minutes of brisk walk or a normal walk, that would be great. If they can manage 10-15 minutes of light exercises, that is great. For elderly, I would say mobility of all the joints, right from your finger joints to your small joints like hands, feet, to the large joints like knees, hips, spine. All these joints should be mobile. Only then the elderly feels good. If they don't keep themselves mobile, they will start reducing the mobility, then confined to the room, then confined to the bed, because their joints will get stiff and they will be mobile, they won't be able to move. So I think the piece of advice you guys can give to your grandparents is, you always tell your dada dani, nana nani to walk, get up from the bed. That's I think the best piece of advice from you guys.
So, sir, we'll also like to know that these days we are told to have calcium or vitamin D supplements for bone health. So, should they be taken regularly or only when prescribed?
The situations are different. You are asking me about children as well as
Adult.
elderly or adults? Both. So for children, I would never advise you taking your calciums or vitamin Ds regularly. They should only be taken once they are prescribed, or once you get the investigation done, your vitamin D levels checked. If you parents feel or your lab says that yes, your levels are low, then you can take it, vitamin D levels. But yes, for calcium, children should depend upon, again, nutrition comes your milk products, your calcium rich diet, all the home foods, no junk food. This should be your motive, that you should stay healthy. For this, your bones to be stay healthy, you should take home food and should not take calcium or vitamin D without any prescription for children. But if we talk about the elderly people, yes, elderly people definitely can take calciums, vitamins, regularly, because at that age, the bone resorption is much, much more than the bone growth. So, the bone growth which is done by the calcium and vitamin D is quite slow as compared to the bones, which is getting resorbed. So, I think they should take these vitamins and calciums regularly.
And it's often seen that a child of a doctor inspires to follow their parents' footsteps. What advice would you like to give to children who have no medical background?
See, I think if somebody is not having a medical background, I didn't have a medical background. First of all, I would say in my family, nobody is a doctor. Neither my parents, neither my uncle, aunt, my brother, nobody. I was the first doctor of my family. So I think if you want to be a doctor, you want to pursue medical sciences as your career, and if you don't have a medical background, it's okay. You should not feel it like, yes, my friend, his father, mother are doctors, parents are doctors, or the entire families of a doctor family. It will be very easy for him or her to do it. It will be difficult for me to do it. No, I don't think so, because there are different advantages and disadvantages on both sides. If somebody's from a doctor family, he's having more pressure. He is under a family pressure. He has to prove himself better than his parents. But other way around, if you don't belong to a medical family, so you are the boss of the house, and everybody will say, "Doctor Saab to you." So I think it's good to, if you don't belong to a non-medical family, and if you want to pursue as a medical science, you should go for it. Work hard, and I can say you can do better even than the children who belong to a medical family. So there is no difference. You should not feel like that you belong to a medical family or it's a family business, doctors, parents, doctors, children. It's very easy to do it. Nothing is easy in this world. I'm telling you, you have to earn your own patients. You have to earn your own profession. You have to earn everything on your own. You should work hard and be sincere to your profession, whichever profession you go for.
And thank you so much, sir, for sparing time for us. We've learned a lot about medicine and leadership and, of course, healthcare from you.
Thank you very much for coming to Sohana Hospital and interviewing me. So I'm glad to see all of you in school dress and taking such initiative. And thank you very much for the Vivek management and the teachers for coming to Sohana Hospital and discussion with me. Thank you very much.
Thank you so much, sir.
Thank you.